Welcome to the Difference of 13 podcast, where we make a difference by doing it differently.
You clap.
You can't clap and we can't do an intro. Welcome to the Difference of 13 podcast. We are so glad that you're here with us today. We are going to be talking about a topic that is very close to my heart that I will probably go off on a number of tangents because I'm just going to get angry about it.
Angry? Or passionate?
I guess it probably might come across as angry, but it comes from a place of being passionate about you, the listener, being treated correctly in the healthcare system. And sometimes we don't do that. And it kind of gets my goat, as they say.
What does that mean?
I have no idea. I don't have a goat to get. But I am Chris Finn. I'm the owner here at Par for Success, and I have with me the beautiful, the wondrous, the legend.
Yeah, right.
Teri Stern.
Hi.
That's all they get?
Yeah.
For that whole intro, and all they get is a hi.
Yeah, pretty much.
Jeez, man, our listenership just dropped.
Yeah, because everybody tunes in for me.
I don't know. I'm just so excited to go. Should we just go into it?
Yeah.
Oh, you know what? You know what we should probably do?
What?
We keep forgetting. If you're enjoying this,
oh yes,
please let me see if you can do this week.
5 stars on whatever platform you listen to podcasts on. If you're on YouTube, give us a thumbs up. Leave us a comment. We'd like to hear what you think, what you wanted to learn more about, what you don't like, but be gentle.
Terry has soft feelings.
Yeah, really. No, I don't.
But
I do want to know if there's something people don't like and we could make it better.
Yeah, me too.
Because we do want to get better.
Yeah, we do. So let's. I think today what I wanted to talk about that I'm kind of forcing on you today, which I think you're like a secret passionate about this topic. I think. No,
I am, because I want everybody to get the most they can out of their physical therapy visits.
And I don't think this is even just PT. I think this is really across all spectrums, right?
Right. Pretty much any medical appointment, any appointment.
Right.
There are questions you as the client patient need to ask. We can't just, I grew up, because I'm so old, with the idea that the doctor was the authority on everything, and you sat there passively waiting for them to share knowledge with you. And you weren't really supposed to question anything or ask anything. But fortunately, that attitude is changing. And we're going to give you some questions that you should ask so that you get the best out of your appointment.
Definitely. Yeah. So I think if you are currently in therapy or you know somebody who is, I think the number one thing that you need to be asking is what, or maybe you want to ask?
Yeah.
Should we do this for some theater?
Yes. All
right.
We'll pretend.
Look at her. She's puffing out the chest, arms on the hips.
So I think the first question you need to ask is, what should you be doing at home? You go to your physical therapy appointment. It's an hour once or twice a week. That's not enough to get you better. So there's things you need to do at home in order to continue getting better. So
that doesn't mean go 3 times a week.
No, because there's still things you need to. You should be doing something pretty much every day, right?
That's right.
Right.
Yeah, in most cases, unless you're in an extreme case where you're trying to build, like you're doing true strength training and you need a day to recover to help build. But your typical physical therapy clinic, that will not be the case. So ask, what should I be doing at home? But Teri, they gave me the 10 to 15 different exercises on this exercise sheet. Isn't that what I'm supposed to be doing?
Maybe not. Probably not.
But why would they give it to me if I'm not supposed to be doing it?
Well, first off, I don't think they should be giving you just sheets of paper with exercises on it.
Is it because you love trees, or?
Yeah, I do. Yeah. I'm kind of fond of oxygen, and they help with that. So, I want to see them stick around. But you obviously know more about this than I do, but they should only be giving you a few exercises, right?
3 to 5.
3 to 5. More than that, I forget them. And I know for me, if there's too many, I'm going to look at that and go, I don't have time for this. But 3 to 5, I might have time for that.
Well, and I think that's important to, when you ask this question of what should I be doing at home on a daily basis, tell your therapist or your provider, tell them how many you like. Dude, I'm swamped. Like, I'm busy. I got 3 kids. I got work. I got like maybe 10 minutes I can put towards this. What can you give me in 10 minutes that will help me to get better?
Right.
And put the onus on the professional that you're paying. You know, if you're using your insurance, you're paying like $300 for the hour if you get an hour with them.
Mm-hmm.
You know, you're paying a boatload of money. Like, put the onus on them. Make them give you the most effective exercises in 10 minutes or in 15, whatever the time is that you have. But if you walk in and, you know, you go through your session and then even there's a lot of good therapists out there who will then throw 10 exercises at you. I think as therapists, we have a reputation of we just add 3 to 5 exercises every single session. By the time you've gone 6 times, little plug here, by the time you've gone 6 times to your par for success, you're usually discharged.
Right.
Because you're feeling better. But, you know, by the time you get to a number of sessions, you're going to have, you know, 15 to 20 different exercises. I can't tell you how many people that have, you know, either failed therapy other places or just over the years have gone to therapy for different things, and they'll walk in. They may not even be coming here because they're in pain. They might just be coming here because they want a fitness program or something along those lines. But they will literally, like, 3 8x11 pieces of paper, front and back, of exercises that they've accumulated, and they look at me and they hand it all to me and they say, which ones do I need to be doing? And that, I think, as a therapist who takes a lot of pride in trying to help people be super efficient and effective with their rehab and with their training, that pisses me off when somebody comes in with that much, because somebody who took a lot of their money did not give them proper directive. And they did not take the time to really help to try to streamline their rehab and towards what the goals were that needed to be achieved.
Well, to piggyback onto that, the next thing you need to ask is, what should I not be doing? Why should they ask that question? What should I not be doing at home?
Many reasons. I think, you know, if I talked about from the therapist perspective, when you come in that initial assessment, I'm looking at lots of different things. I'm trying to really pinpoint where your problem is coming from. And, you know, and that means I'm trying to figure out what's causing your pain, but I'm also should be thinking about why is that pain occurring and what do we need to do to address that as well? Because if I just fix your pain, but I don't address why that pain's occurring, then I'm not solving your problem. I'm just fixing a Band-Aid.
Your pain's just going to come right back.
Exactly. So I think that's where we really want to address, you know, so I get so passionate, I forget my train of thought. But so I think when I'm, as a therapist, I'm focusing on all of that. I'm going to tell you, all right, this is what I need you to do. And I may not necessarily ask you, hey, walk me through a normal day. I had one client who her laundry is up on the 2nd floor. And so she'll make 15 to 30 trips a day up and down the stairs, and she's coming to me for knee pain. Well, that's probably going to negatively impact how your knee feels at the end of the day. Better, yeah. Right. So when she tells me, hey, I wake up in the morning, it feels great. By the afternoon, it feels awful. And then I'll say, well, and maybe this is on a Monday. And I say, well, you were fine all last week. What happened? Well, I don't know. I was just at home. Because to her, going up and down those stairs doing laundry all weekend is normal. It's normal, yeah. So I think as a therapist, it's our responsibility to dig deeper and figure that out before it happens, or at least catch it right at that moment. But for you as the patient listening, you know, ask the therapist. You know, think of everything you do in your day, and that, you know, maybe it's repetitive, maybe you may not think it's different or excessive, but, you know, hey, is going up and down the stairs 15, 20 times, is that a problem? You know, think about those things in your life that you do on a regular basis and ask. And I think the starting point is probably just asking the question, what should I be avoiding? Right.
What's going to irritate this and get me back to being in pain?
Right. Because any therapist worth their fee will be able to tell you very clearly and concisely, like, hey, these are, if your knee hurts, these are the 3 things you should be avoiding, or if it's your shoulder, you know, you don't be lifting stuff up overhead. You know, whatever, you know, the anecdote may be, you know, for that. But I think that's hugely, hugely important to ask, you know, first and foremost, what do I need to be doing at home on a regular basis? And this is how much time is actually feasible for me. And if you give me anything more than that, I'm not going to do it. Be honest from the start.
Right. Because if they think you're doing your exercises and you're not, well, you're shortchanging your appointment, because they need that accurate data to figure out what's going on.
Well, and honestly, you're going to be the patient when you walk in or they see on their schedule, like, oh, crap, here she comes again. The lady that never gets better, the guy that never gets better, but they're always complaining and telling me.
That was me, right?
Well, yeah, honestly. Why do you think I said she?
But that was I was doing my exercises. It was for different reasons that we didn't know at the time.
But yeah, don't be that patient. Do your stuff and just be honest with somebody. As a therapist who's on the other side of the table, and sitting there with you and going through your rehab with you, I can help you much more so if you are honest with me.
Right. You guys understand, like, we have a life. It's, rehab can't be our 24-hour-a-day task that, regular life creeps in, and sometimes things get busy and you didn't do your exercises for the past week.
Right. And so just don't be surprised when you don't necessarily feel a whole lot better that week. and I think, beware of that therapist who tells you to do something 7-8 times a day, 30 different exercises. The absolute only exercise that I can think of that would be done more than twice in a day would be if you have like a disc issue and you're doing like McKenzie type extension, which is repetition, trying to get that disc back into spot.
Mm-hmm.
They're gonna every hour you're doing 10 or so. So that would be the only one that would be. Again, that's a single like 1 or 2 exercises that they're just having you do repeatedly to try to centralize the pain that you're having from the disc pushing on the nerve. But beyond that, like, you should not be doing like squats or sit to stands 10 times a day. Make your therapist be realistic with you. Right. So I don't know. Did I go off on too much of a tangent there?
No.
Okay.
So then the next step should be, what you need to do, what you should not be doing.
Oh, this one's going to get me fired up.
How do you know whether or not you're getting better?
Because you said you feel better every time you come and see me.
Right? Or you say, no, there's no change, but there really is change. How do you know?
That's a good question.
Mm-hmm.
I like two words called objective measures that many therapists don't do.
No.
And I think test, retest. Let me say that again. Test, retest. In between the test and the retest comes an intervention or an exercise, or whether it could be dry needling, it could be active release technique, it could be a McKenzie. We just talked about that sort for your back. I think you come in, the therapist every time should be asking you how you feeling, whether it's a 0 to 10 or whatever the objective measure is that they're using. Let me see you touch your toes. Okay, you got down to your knees last time. Today you're down to your shins. Mm-hmm. That's better. Then it doesn't hurt this time. Or, I have actually right now a guy with a shoulder problem, and every time he comes in, we have him put his arm out and then reach behind him as far as he can go, and we measure how far it goes. And every week it's gone further. Last week he came in and his subjective, or his thought was, it feels exactly the same. But then we went and measured objectively. He actually had like doubled how far he could move. He just was still getting pain at end range, but his end range was like double.
Yeah.
So, subjectively, his perception was it feels exactly the same. It's still hurting. But when you measured it, it went so much further. We put his hand behind his head and we'd have him open his elbow up and we'd say, we'd measure how many degrees it opened up. Way further. So I can objectively say to him and show him the numbers and say, hey, this is what's getting better. And I think the flip side is I think what more so happens where there actually is no change, but there's the white coat effect, or the person saying, well, it feels a little better. Maybe they just didn't do anything. They're guarding it so much it didn't hurt. And then the therapist like, oh, okay, great, awesome, great. Yeah. What I'm doing's working. This is phenomenal. Let's
keep doing it.
Let's keep doing it. And then 8 weeks later, you're like, dude, it's still the same.
Yeah.
But I think you got to make them.
I know
measure.
For me, on the patient side of it, it can be hard to really measure that over the course of a week, maybe 2 weeks, because you tend to focus on just how has it been like the last couple of days. Mm-hmm. And, for the patient, I think keeping a journal or a record somehow of on, day 1, my pain level was this, day 2, and you can kind of see a trend, but having those objective measures where it's not just relying on how do I feel,
right?
It's what can I
track how you feel?
What can I actually do?
Right. That's called subjective objective. Mm-hmm. So you track how you feel when you woke up. How'd you feel at noon? How'd you feel at dinner time? how is it changing? Maybe your pain is still coming on at 5 out of 10, but maybe now it's starting at 5 o'clock at night as opposed to 8 o'clock in the morning.
Right.
So now you're getting through the day more so before that pain comes on. So force your therapist or your doctor, whoever your healthcare provider is, don't just take their word for it. Jerry Maguire, show me the money, right? Show me the progress,
right? You need to be able to
show it to me. Like, shut up talking to me, show it to me. Because if they can't do that, then go somewhere else. You're wasting your time and your money. I mean, and this is where I get fired up, but I can't tell you how many people come into me. They've been seeing somebody for 2 months, or they've had the pain for a year. And it's like, well, how much did you go to therapy? Because my initial thought was like, well, you dummy, you should have went to therapy. What were you doing? But then they come in and they're like, well, yeah, I went to therapy. Really? Like one and you left? Like, you clearly didn't do your exercises. You didn't do anything they told you to do. Because, dummy, you shouldn't still be hurting now. And they're like, well, no, I went for 6 months. And it's like, uh-oh. Yeah, okay, well, did you get any better? No. Well, what'd they do? They gave me exercises. Okay, great. Did they change them up at any point? What were the exercises? No. I'm like, oh God, here we go. All right. So at this point, I'm just humoring myself, and I say, all right, why don't you tell me what your therapy sessions were like? I kind of sit back in the chair, because I already know what they're going to say. They're going to say, I came in, they put me on the bike or the arm bike, whatever it was.
To warm up.
They'll leave you there for 8 to 10 minutes so they can bill you for a unit. And then they're going to say, and then, then they went over, they might rub on me for a little bit. And most of the times they don't even put their hands on you because manual therapy doesn't reimburse well.
Right.
So, then we went over, did some exercises. Oh, great. So you did the exercises with the therapist, right? And they cued you?
No.
I don't know what they were. It was a kid, a younger person, and they had 3 or 4 people. Okay. So you're with the tech.
Yeah.
Who's the $10 an hour employee. And they billed you for 1 to 2, units of therapeutic exercise. And then I'd see the therapist, and they might move my ankle for a little, or they put me on a machine like the TENS machine, or they put me on ultrasound, which doesn't work. If anybody here is getting ultrasound, go somewhere else. The research is incredibly clear. Stop getting ultrasound. See, now I'm yelling at the mic and everything.
I know.
So.
Sorry, Caleb, the sound quality is going to be weird there.
But yes, that's if you're not getting better in 2 weeks, you have a 2-week window. If you're doing something for 2 weeks and there is no change, ask a therapist and say, because this has happened to me, it's been 2 weeks, and I've said, but it need to be, hey, I've been measuring you for the last 2 weeks. You've come in last week and this week. You're not getting in. There's not any change. Objectively or subjectively, maybe you're even getting worse subjectively. Well, then either I got the wrong diagnosis, or B got the wrong treatment.
Right.
Something needs to change around that.
And by better, you don't mean they're healed.
No,
better
but
means just showing some
instead
improvement.
of an 8, they're a 5. Instead, instead of it starting at 8 a.m., it's starting at noon. So make them prove it to you. Measure it. If you're going anywhere for therapy for more than 2 weeks without change, you need to either you got the wrong diagnosis or you got the wrong treatment. One of those needs to be addressed. If neither of those is addressed and you're at 3 weeks and 4 weeks, don't sit there and shut up. Speak up. Right. Say something. Tell them you heard it from me, that you needed to ask, and put it on me. I can be the a-hole. That's cool. But be a true advocate for your health. Right. You're wasting your money. They are in my opinion, if somebody allows you to go 4 weeks without change and they don't address anything, they are stealing from you financially, they are stealing from your family for your time, and they're stealing from anything else that you love to do. It is absolutely unethical. There is zero integrity in it, and it needs to stop in the healthcare fields. We need to be objective in how we measure things, and we need to empower patients, you listening right now, to prove it to you that we are helping you. And if we're not, hold us accountable.
Right. It may not be a good match between therapist and patient.
No, it may not be.
It might be time to move on.
Yeah, it may not be the therapist's fault. Maybe it's a bad system that they're stuck in, or whatever it may be. But you don't need to go there. You have so many other choices in this world for healthcare. There's so many other providers that we're blessed with here in the United States. Go somewhere where they're going to actually measure you. They're going to actually take care of you. And spend your money and your time there, because you only have so many days left on the earth. Me and you know that, I think, more acutely than some.
It can go real fast.
Blink of an eye. So really take matters into your own hand. Ask these questions. These are so important, so that you can really get better and get back. You don't want to spend your time in a clinic.
Now, if you go to a therapist or a doctor and you start asking these questions and they get upset by it.
Peace. See you later.
Bye.
Bye.
Yeah. If they can't handle you asking basic questions, then it's not the right person, because you should be able to ask questions.
Yep. Go somewhere else and tell everyone you know to go somewhere else too.
Yeah. Because I think it's unethical for them to not be able to answer. I mean, these are basic questions.
Yeah. How do you know I'm getting better? If they get all up in arms and like their panties are in a bunch.
Yeah.
To
me, that says they have something to hide. They don't really know what they're doing.
Yep.
I could be wrong, but that would be my guess.
Which is, I'm sorry, I'm going for a plug for cash therapy, cash services. You are not going to be in business as a cash provider if you do that. In university systems, a lot of the insurance-based systems, you can get away with that,
right?
Because the people just keep coming,
right?
But so that's, I think, going to a direct pay facility, they're not going to be in business if that's what they do. Look at Google, look at their reviews, and this is one of the things that I'm most proud of. We have over 85-star reviews with nothing less between Google and Facebook,
right?
You don't get that if you're if I get my panties in a bunch because you asked me, how do you know I'm getting better? You're going to go I deserve a 1-star review and go off on me. Like the rental car place we went to in Orlando.
Oh, gosh.
They were terrible.
If you could have given them less than 1 star.
I would have. That's the only rating I've ever done in my life, by the way. But yeah, I think really be an advocate for yourself. Go places where they love when you ask. I love when somebody asks me these questions, because I know that they're truly engaged in themselves getting better. And I know that they're going to be the type of person that is going to get better really, really quickly with what we're doing.
Right. Because, that's the other part of it. You can't be a passive patient. You can't expect the physical therapist or doctor to have some magic wand that is going to make you better. You're going to have to put in work. And it's not fun. I do not enjoy doing all those exercises. But I know if I want any chance of making improvement, you got to do it.
I didn't enjoy watching you do all those exercises.
No. And you still don't.
I still don't. So, all right. So just to recap, you need to be asking, what are the 3 questions, Teri?
What should I be doing at home? What should I not be doing at home? And how are we going to measure my improvement?
Or just put your hands up and say, show me the money.
He really likes doing that.
I do. It's a great movie. Jerry Maguire, everybody.
Yeah, it was a good movie.
Yeah, it was a good movie. So, all right. So hopefully you guys had a few actionable tips. Take those 3 questions with you to the next visit that you have. If they get their panties in a bunch, just smile and give them my email address.
Right.
Chris@powerforsuccess.com. I'd love to hear from them. That would be fun if they actually did email.
That would
actually,
be
give them the phone number, right?
Yeah.
I would love to talk to them. 919-377-2084. That's our phone number here. Maybe we could even record them. That would make for an awesome episode.
That would be a fabulous episode.
Oh man, that would be funny. So, but yeah, as always, 5 stars, thumbs up. Wherever you are listening or watching us, please share this with your friends. Share this with anybody who you know, coworkers, colleagues who may be having problems with their health physically. Our goal is to really empower you, the listener and the viewer, to take care of yourself. Put your healthcare, take it in your own hands. Take control. Take it by the reins.
It's your money.
Get better. Yeah,
your money, your body.
Your money, your time. It's all yours. It's not mine as the healthcare provider. It is absolutely yours. Not all health providers agree with me, but let them call me and we can chat.
Happy to do it.
So hopefully you have a great week. Hopefully my passion there didn't cause anyone to get into an accident if you're driving. Or maybe you just laughed at me, in which case I'm glad I could hopefully be the best part of your day there. And we will see and talk to you next week. Do we want to tell them a little bit about next week?
Or do we want them to just wonder for a week?
We'll leave them with this.
Okay.
We're going to talk to you about how to fix on your own one of the most common problems that people who work at desks have.
Ooh, yeah, that would be me.
Well, you have lots of...
Well, so many problems.
We can't fix you. So make sure you guys tune in next week, and we will see you then.
Bye.